Hey everyone, welcome back to my channel. My name is Dr. Gonzalez. I'm a naturopathic doctor, and today I will be discussing the difference between naturopathic and conventional medicine. So if you're new here, make sure you subscribe so you never miss a video, and let's get into it. So first I will be discussing how one even becomes a naturopathic doctor, the philosophies that make up naturopathic medicine, and then the key differences between naturopathic and conventional medicine. So you might be asking yourself, what is a naturopathic doctor? I feel like when a lot of people hear naturopathic doctor, they kind of get scared and they think of like herbal witch doctors and witchcraft and I don't know, like pseudoscience, but it is neither of those things. Naturopaths have to attend accredited naturopathic medical school, and there are about only like 8 in the whole country. So if you are working and dealing with a naturopath and they did not attend one of these accredited naturopathic schools, they cannot call themselves a naturopathic doctor. They may be referring themselves to a naturopath, but anyone can call themselves that. So you want to make sure that your naturopathic doctor did in fact attend one of these schools. Otherwise, they're practicing without a license. Once a naturopath finishes naturopathic medical school, it's 4 years after you received a bachelor's, so very similar to medical school. They have to take a board exam, then apply for the license, and then keep up with their license, make sure it stays active, and then keep up with continuing education, just like a medical doctor would. Naturopathic doctors are very similar to primary care physicians. We are trained pretty much identical to primary care doctors. Therefore, we can treat any condition that your regular primary care doctor can. The key differences lie in the philosophies that we follow. So let's get into what those philosophies are. So the first naturopathic principle might sound familiar to you because it's identical to that of medical doctors, and that's first do no harm. So what does first do no harm means? Pretty much exactly what it sounds like. You never want to do or recommend anything to a patient that might harm them more. So that may look like maybe not recommending a treatment that's going to leave them worse off than they already started. It might look like referring them out to a specialist if you feel like their issue is just something that you cannot help them with. And it also looks like using the least invasive and most natural types of therapies in that moment. The second naturopathic principle is the healing power of nature. So as naturopaths, we really help the body heal itself because we know that it is able to. We really help to harness the body's innate healing abilities by either removing things that aren't serving the body or adding things in that can help nurture and restore that balance. The third naturopathic principle is identifying and treating the root cause. We never want to suppress symptoms. We can help manage them naturally, but we are always trying to aim to get to the root cause of patients' symptoms. We understand that symptoms are the body's signal that there's something going on, right? The symptoms are just merely a sign that there is an underlying imbalance. So we really don't want to suppress the symptoms because they're trying to tell us something. I'm going to give you an example of how this may play out in an actual clinical setting, right? So if you go see a naturopath for, let's say, abdominal pain and diarrhea, they're not just going to give you a medication to help suppress your pain or to stop the diarrhea. We want to figure out where that's coming from. So we may talk to you about your diet, your stressors, anywhere that you may have traveled, and we may even do a stool test to see what's going on. The fourth naturopathic principle is doctor as teacher. As naturopaths, we're not just telling you what to do, we're educating you as to what's going on and why we're recommending what we're recommending. I feel like when the patient is on board and understands what's going on, they're more likely to follow through with treatment. The fifth naturopathic principle is treat the whole person. Just because someone is coming in with a certain symptom, let's just say like acne, we're not just going to treat their skin topically because that wouldn't be treating the whole person. We really want to figure out where is that inflammation coming from? You know, maybe it is their skincare, but maybe it's not. Maybe it's their diet. Maybe it's their hormones. Maybe it's their gut health. So we really want to treat the whole person when addressing their health, not just specific symptoms. The last naturopathic principle is preventative medicine. It is better to be preventative and proactive versus reactive because it will just make it so much easier if we can hopefully prevent you from suffering, getting sick, spending lots of money on testing, supplements, medications, if we can just practice a healthy lifestyle right here and right now. So this is what I do with all of my patients that come in to see me. I let them know that it's very important to continue having these healthy habits because it will prevent you from hopefully developing a chronic disease later on. So preventative medicine is huge in naturopathic medicine. And unfortunately, we are getting a lot of those chronic patients who maybe didn't know about naturopathic medicine before. And it is very hard to reverse a disease process once it's already set in. So hopefully with these videos, I spread more awareness regarding naturopathic and preventive medicine so that we can keep people healthy and out of hospitals. Now that we talked about the philosophies of naturopathic medicine, let's talk about the logistics. Naturopathic doctors are only licensed in certain states, about 26 jurisdictions, including Puerto Rico, DC, and the Virgin Islands. Out of those districts, about 12 states recognize naturopathic doctors as primary care doctors, meaning they can do almost exactly everything your primary care doctor can do. They can prescribe, they can diagnose, they can order blood work, imaging, they can administer vaccines, IVs, whatever it might be. They can do it all in those states. However, other states have more limited scopes of practice, like myself. I work in Connecticut, and we can't prescribe, we can't do minor surgery, and we cannot inject anything into a person. If you're in a state that does not license naturopathic doctors, don't worry, because there is ongoing legislation in a lot of these states to be able to give naturopathic doctors more rights and recognize them as real physicians. Another question you might have is, do naturopathic doctors accept insurance? And the answer to that is, it depends. So they only have the ability to take insurance in the states that they're licensed in. So if your state does not license naturopathic doctors, well, your insurance will not cover them. And if you are in a state that covers naturopathic doctors, you just have to check with your insurance policy to see if your specific plan will cover them. A lot of naturopathic doctors will choose to actually not take insurance because they just have their hand too much into what we can and can't do for a patient, including how much time we can spend with them. This is another big difference between naturopathic and conventional medicine, where insurance totally dictates in conventional medicine how much time is allowed to spend with each patient. So one might feel frustrated, right? If they go see their primary care doctor and they're only spending like 5 to 10 minutes with them, and then they go see their naturopath and they're spending upwards of 30, 40, 60 minutes with them. It's just the way that insurance is broken down. It's not that your doctor doesn't care about you or your health. They just literally only have so much time with each patient. Naturopathic medicine does not have a standard of care per se as conventional medical doctors do. So we still adhere to it, of course, because we don't want to be negligent. So if someone comes in with dangerously high blood pressure, we're not just going to give them like a diet plan and an herb and say, good luck. We're going to refer them to the emergency room so that they can get the care that they need, okay? But what naturopathic doctors do follow is something called the therapeutic order. And the reason this exists is because we have so many different modalities in our toolkit that's why there isn't a standard of care in naturopathic medicine. Because we have so many options with patients. We can do a lot with diet. We can do a lot with herbals, nutraceuticals, physical medicine, homeopathic medicine. So there's not a protocol or an algorithm. And honestly, 2 patients can come in with the same exact condition and leave with vastly different plans, because that's what personalized medicine is. So basically, naturopathic and personalized medicine go hand in hand with each other. So that was a lot of information, but hopefully now you have a bit of a better grasp between conventional and naturopathic medicine, and understand that our goals are the same, and that's to help you feel better. Honestly, in a perfect world, I think everyone should have a primary care and a naturopathic doctor to help them achieve optimal health. There's definitely a time and place for either one, but honestly, I find that it's best when you have both on your team. So thank you so much for listening. Take care of yourselves, and I'll catch you next time.